Hello, my name is Brian Harkins. I'm a community-based general surgeon practicing in Tomball, Texas, just outside of Houston. So hernia surgery has had a long history of evolution. Open hernia surgery was a standard for many years, up until about the 1960s when the advent of mesh came along. That had been done with just suture closure of the defect. Mesh was able to be incorporated and recurrence rates dropped significantly as a result of that. Later in the late 1980s, early 1990s, the minimally invasive era began, and laparoscopic surgery was able to be done at that time to repair the hernia defects. Now, there's been an ongoing battle for many years about open versus laparoscopy. Minimally invasive is better for the patient if you can do the same quality surgery, and quality, of course, refers to outcomes, the value of doing the procedure in terms of cost, and things like that matter to the patient. But the problem has been that it's technically very difficult, and as a result of that, in the U.S., only about 25 to 30% of all hernia surgeries have been done using the laparoscopic approach. The remainder have been an open technique. In more recent years, the robotic platform has become available and has become widely adopted in the U.S. As a very, very popular procedure amongst general surgeons. That threshold of 25% is about to, if it hasn't already been broken by the robotic platform. And interestingly, a lot of those conversions to that platform are coming, yes, some from the laparoscopic world, but just as many are coming from the open technique. Finally, this has been a procedure because of the articulating instruments and the better view and the more natural flow of doing the operation that open surgeons have felt comfortable moving into the robotic platform. So the improvements are manyfold. There are many improvements for the patient, but as well as for the surgeon. And I won't go into the detail on the surgeon improvements. But for the patient, there's increasing evidence that there may be a decrease in pain perception after the procedure. Certainly over open, it's better. But even comparing it to laparoscopic, because of the lack of a need for tacks, there can be some improvements in that aspect as well. Now, recurrences is another important thing to patients in the long run, and the recurrence data at this point seems to be comparable with perhaps a trend towards improving as well. The lastly would be things like wound infections, and they seem to be very comparable if you're talking about laparoscopic, whereas from an open standpoint, all of these surgeons who are now moving to the minimally invasive surgical platforms are able to offer lower infection rates as a result of that. So I'm frequently giving talks. I've had the benefit of talking across the United States and in several cities internationally. And I've been very surprised at the commonality of the questions and the commonality of the pushback, if you will, that I receive. Many surgeons are at the point where they understand robotics to be something that should only be used for complex procedures, and they question, why would you even do a hernia repair using the robotic platform? And my answer to them is simple. I want to do the best possible surgery for my patients that I can. There are many benefits to the robotic platform that allow me to accomplish that. Now, in the process of developing Facile on the system, we have looked very closely at our finances to make sure that we weren't causing additional cost to not only the patient, but to the entire system. And with attention to that, you can very easily bring robotics into equivalent or even better positioning from a financial standpoint, and that includes the purchase of the robot itself. So we've made great strides in keeping things better from a cost standpoint, which is one of my biggest pushbacks, and it only takes a few cases for a surgeon to feel and see the improvements of the robotics before they convince themselves that it's better from their perspective.